This formula contains a combination of vitamins, including vitamin B6, vitamin B12, and folic acid, which are essential for maintaining good health. It is especially beneficial for individuals who may not be getting enough of these vitamins through their regular diet. This formula helps to support the body's natural processes and overall well-being. The recommended daily dosage is to take 1 tablet daily, preferably with a meal. It is best to take this formula at the same time each day to ensure consistency and effectiveness. This formula should be taken orally, either with or without food, typically once a day as prescribed by your doctor. If you experience stomach upset, taking this product with food may help. It's important to use this formula regularly to receive the maximum benefit. To help you remember, take it at the same time every day. The dosage will depend on your medical condition and how you respond to the treatment. Some common side effects of homocysteine formula may include nausea, stomach upset, diarrhea, drowsiness, flushing, and numbness/tingling. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist promptly. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to inform your doctor right away if you experience any serious side effects, such as mental/mood changes or unusual weakness. While a very serious allergic reaction to this medication is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. In terms of daily dosage and timing, it's best to follow your doctor's instructions. They will be able to provide specific guidance based on your individual needs and medical history. It's important to talk to your doctor or pharmacist before taking homocysteine formula if you have any allergies or if you are allergic to any inactive ingredients that may be in the product. It's also essential to discuss your medical history, especially if you have certain blood disorders. Homocysteine formula may cause drowsiness, and consuming alcohol or marijuana, cannabis, can increase this effect. It's important to avoid driving or using machinery until you can do so safely. It's also recommended to limit alcoholic beverages and to speak with your doctor if you are using marijuana, cannabis. If you are pregnant, homocysteine formula should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. This medication can also pass into breast milk, so it's essential to consult your doctor before breastfeeding. As for the optimal timing, it's best to follow the dosage instructions provided by your doctor or pharmacist. When taking the homocysteine formula, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include altretamine, cisplatin, levodopa, when used without carbidopa, folic acid antagonists, such as methotrexate, hydantoins, such as phenytoin, diphenylhydantoin, and pyrimethamine. Additionally, this product may interfere with certain lab tests, potentially causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you are using this product. As for the daily dosage, it's best to follow the instructions provided by your healthcare provider or as indicated on the product label. The optimal timing for taking the homocysteine formula may vary, so it's recommended to consult with your doctor for specific guidance. It's important to be cautious and informed about potential interactions and effects when using the homocysteine formula to ensure your safety and well-being. If you suspect an overdose or experience severe symptoms such as losing consciousness or difficulty breathing, seek immediate medical attention by calling 911. Alternatively, contact your local poison control center for assistance. U.S. residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. When taking this medication, it's important to remember not to share it with others. Your doctor may also request lab or medical tests, such as a complete blood count or homocysteine levels, while you are taking this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. It's best to get your vitamins and minerals from healthy foods and maintain a well-balanced diet. B vitamins, including folic acid, are naturally found in leafy greens, other vegetables, and citrus fruits. Folic acid is also found in enriched grains such as bread, pasta, and cereal. Additionally, some brands of this medication may contain ingredients such as vitamin E, para-aminobenzoic acid, or alpha-lipoic acid. If you have any questions about the ingredients in your brand, be sure to consult your doctor or pharmacist. And as always, follow your doctor's dietary guidelines and recommendations for the optimal timing and daily dosage of this medication. If you forget to take a dose of the homocysteine formula, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. It's important to stick to the recommended dosage and timing for the best results. It's important to store the homocysteine formula at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard the product by consulting your pharmacist or local waste disposal company. Do not flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.